Can you hear me now? All right, so can you hear me now, Rose? Rose. All right, so can you hear me? All right, awesome. You all, I do apologize. I'm not sure what happened with the sound, but we're going to start over again. Awesome. Yeah. So validation therapy would be example of A, clarifying the date and the time, B, asking a resident, do you remember my name? C, allowing the resident to treat her doll as a real baby, or D, reminding the resident who is looking for her husband that her husband has died. And I see that Belinda chose C. And Rose, awesome. I'm glad you can hear me now. I do apologize for the technical issues. And the answer is C, validation therapy. And this is kind of confusing because if you're a caregiver, you're always told not to feed into a resident's false belief, to try to reorient them. But when someone has in time or late stage dementia or Alzheimer's, you're not going to help the situation by not validating their feelings. So the correct answer is going to be C. You're going to acknowledge the person's feelings rather than try to reorient them, because at this point they have dementia that's so bad, you're just going to frustrate them. Let's see what number 2 is. Number 2, you enter Mrs. Bellow's room this evening and she yells at you for not coming in sooner. Your response should be A, I am sorry. I do have other residents to take care of. B, there is no need for you to yell at me. I'm here now. C, I am here now. What can I do for you? D, shall I ask the nurse to give you another nurse aide? Hi, Renee. Hi, Peter. Hi, Rose. Hi, last name is Lucius. Um, what do you think the best response to number 2 is? Yes, good job, everybody. See, I am here now. What can I do for you? You all, and we love our CNAs, but you all, like, you get the brunt of most everything. These patients can be disgruntled, they can be resentful about their own health. And because you are the one who spends the most time with them, sometimes you're the ones who get the most of the verbal abuse. But I need for you to focus on the task, focus on the interventions that you have to perform, and just try to maintain your composure and don't get upset with your patient. So you're going to just be straightforward and say, I'm here now. How can I help you? And if you want to apologize for, not being faster, you can, but at least acknowledge the fact that, you can help them now if they allow you to do so. Number 3, Mrs. Evans has a diagnosis of diverticulitis. Whenever you see itis at the end of a word, that means an active inflammation. So she has inflammation. Which food should she avoid eating? A, lettuce, B, hot dogs, C, milk and milk products, or D, strawberries. All right, so what would cause a diverticulitis? What would cause a flare up? This one's hard. It's going to be D, strawberries. Okay. So, and close, because I would have thought it would have been milk too, but that's more for those people who are lactose intolerant. But whenever someone has diverticulitis, they have pouches, like their part is protruding out. And so they have to avoid seeds and nuts or things that could get stuck. So that would cause a worsening of their condition. Yeah, hot dogs, that wasn't a good option either, Renee. I agree. All right, number 4, you are the CNA caring for Mr. Sanchez. You have been told that he has a social anxiety disorder. He can't be in crowds, you all. How can you plan your care to help his daily routine? Okay. A, when you see other residents having small group conversations, take Mr. Sanchez there and introduce them to him so that he can join in. D, put Mr. Sanchez with a group of men at a lunch table because this is the best time of day to deal with these fears. Or C, encourage him to, I can't see it again, talk about his anxiety and specific discomfort while you're performing his ADLs. You all, what does ADL stand for? What does it mean, ADLs? To repeat back to the care team. What are ADLs? The answer is C. All right, so I put a question in the comments. The answer is C. You're going to encourage him to talk about his anxiety. Please do not put him in an uncomfortable, situation, making him sit with men that he's not familiar with. But you're going to talk to him about his anxiety, get him to open up, and then you can relay those his messages, his concerns back to the care team. Yes, it is activities of daily living, and the way I look at it is that if a patient doesn't have a deficit with an ADL, you as the CNA or myself as the nurse, we really don't have a job. So we're going to be doing something to help this person, whether it's getting them dressed, we're feeding them, we're bathing them. As a nurse, I'd help them with medication management. And so helping them socialize is also a part of ADLs. All right, number 5, which of the following is a HIPAA violation? A, sharing the patient's PHI, primary health information, with an unauthorized person. B, trading patients' names with the Avon lady, oh my God, in return for cosmetic discounts. Does anyone still wear Avon? C, tell your Bible study group how a fellow member is doing in the hospital. Or D, all of the above. Which of the following are HIPAA violations? Confidentiality. Right. So I would think that if you gave your patient's information to the Avon lady, yes, Joy and Renee, that would definitely be a breach. So pretty much all of these, whenever you're thinking about confidentiality or and HIPAA, you don't want to share the patient's information without anyone who is not part of the healthcare team. When in doubt, ask your nurse. Great job. And there's the answer there. D, all of the above. All right. 6, what sense does a retinal detachment affect? Where is the retina located? Retinal detachment, does it affect the hearing, smell, balance, or vision? All right, I see a lot of D's there, and you're correct. So the retina has images and light reflected on it so that it can send messages to the brain to develop visual interpretation. Therefore, a retinal detachment affects vision. Great job, everybody. Number 7, Mrs. Jones has dementia. She spends many hours rummaging through a large pocketbook, removing and replacing items such as washcloths and plastic spoons, and then repeating her actions. You should. A, remove the pocketbook while she is sleeping so she will forget it. B, ask the family to take the pocketbook out of the facility. C, replace the pocketbook with a different one. D, allow the resident to use the pocketbook as and handle it as she chooses. What do you think is best for Mrs. Jones? Is the pocketbook or the purse hurting anybody? And this one's too easy. It is also D. You're going to allow her to keep it and handle it as she chooses. It's not hurting anybody. It's an activity that she enjoys. And so she should be permitted to continue to use the pocketbook. 8, dementia is a loss of what type of function? Cognitive, chronic, sensory, or specific? When someone has dementia, what type of function is lost? It's cognitive, but thank you for answering. So, cognitive dementia is a loss of cognitive or mental function. Alzheimer's disease is one form of dementia. Alzheimer's is a more chronic form of dementia. Okay, so whenever someone has dementia or Alzheimer's disease, they have a cognitive or loss of function within their brain. Number nine, Alzheimer's disease patients wander. That means they walk a lot. The dangers associated with this wandering can be prevented with which of the following: A, bed alarms, B, chair alarms, C, door alarms, or D, all of the above. How do we keep our Alzheimer's patients safe? Yes, Joy and Rose and Renee, great job. The answer is D, all of the above. So, bed alarms, chair alarms, door alarms that ring when a wandering person tries to leave the building will help to keep them safe because it will alert the staff. It's going to alert that CNA that, hey, my patient's trying to get up, they're trying to get out the bed, or they're trying to leave this building. Let me go check on this alarm and thereby check on my patient. Number 10, people with any physical, mental, or emotional problem, they're referred to as A, handicapped, B, victims, C, disabled, or D, disease stricken. Hi, Sandrine. If I have a physical, mental, or emotional problem, I'm going to tell you now the answer is not A, handicapped. That's a bad term. They're not necessarily victims either, Joy. We're going to classify them as disabled. So the answer is C. So disabled is the preferred term, which focuses on the person rather than the condition. All right, this one, I know you're going to get this one. Number 11, your patient has shown the following signs and symptoms: feeling very thirsty, large amount of water intake, dryness of mouth, and urinary frequency. What physical disorder does this patient most likely have? Is it A, diabetes, B, angina or chest pain, C, hypertension or high blood pressure, or D, hypotension or low blood pressure? Thirsty all the time. Yes, Rose. Yes, Renee. It is A. That is a sign of somebody who has uncontrolled blood sugars. So they have diabetes. So the explanation is this patient is exhibiting the classic signs of diabetes and high blood glucose or blood sugar. Some of the other signs include poor vision, weight loss, tingling of the feet and hands, and feeling tired and weak. And so this is when the person goes to the doctor, they check the blood glucose levels, and we find out that their sugars are elevated. Once we find that their sugars have been elevated, we will then, the doctor will prescribe some type of anti-diabetic agent. It could be a pill or it could be insulin. And then that's when we see the untoward effects when their blood sugars get low. And that's when they get really sleepy, hard to arouse, and we call it diaphoretic. That's when they're sweating. Either way, they need medical treatment. So, but in this case, we're talking about the classic symptoms of a high blood sugar, which are opposite than those of a low blood sugar level. Number 12, you are doing postmortem care on a resident who is a coroner's case. That is not a good term. Which of the following actions is not to be performed in this case? So when you think of coroner's case, think of crime, think of malpractice, think there's going to be an investigation. All right. So which of the following is not to be performed? A postmortem bath. B, place the person in a shroud and place a toe tag on them. C, remove all tubes, IVs, catheters, and airways. Or D, you do all the usual postmortem care. Great job, everybody. I know Renee. It's not A, Peter. You could actually give the bath, but what you can't do is you can't do C. And if you haven't worked in a hospital just yet, In Florida, the patient care techs or those CNAs who have hospital level experience, they assist with postmortem care. But if it's a coroner's case or if an autopsy is going to be performed, we cannot remove any of the tubes, the IVs, the catheters, or if they're intubated, we cannot take out those airways because maybe there was an error by the nurse or the doctor. We have to keep all of these items in place so that they can go ahead and do the autopsy, so they can clear the nurse, the doctor, or either they can prove their case in court. And so you would leave those tubes in place. Yes. 13, you're caring for an Alzheimer's patient who is confused. What can you do to decrease the level of confusion? A, nothing will help to decrease the confusion. B, keep the level of stimulation to a minimum. C, challenge the person to a game of Scrabble. No, don't do that. D, ensure the patient's safety at all times. What can you do to decrease the level of confusion? Yeah, so postmortem care, Renee, is the care that's performed after death, and just depends on what state you're in. A lot of places in Florida, we have to provide the care. The nursing team does so. All right, so back to number 13. All right, so Peter and Joyce said D. Renee says B. All right, Belinda says D. It's B. So I know that one's tricky, right? And it's tricky because the key word here was you're trying to decrease the level of confusion. And so keeping them safe does not decrease the level of confusion. Keeping the amount of stimulation down, so you don't want loud sounds, etc. So confused patients can benefit from a quiet environment without noise and a lot of stimulation. For example, you have the TV on at night, and it's something that's going to keep them awake. Well, they already have their clock is off. So sometimes they're awake when they should be asleep and asleep when they should be awake. So keep the stimulation down to a minimum, and that should help them be less confused. 14, which of the following may be caused by or made worse by a compromised immune system? What is the purpose of the immune system? Like, what does it do? Hi, Sandrine, who lives in New Jersey. All right, so what happens if you have a weakened immune system? This is compromised. What happens with a weak immune system? Are you more likely to get infections or less likely? All right, Belinda put C. Renee put A. All right, so which of the following may be caused by or made worse by a compromised immune system? A, Crohn's disease, B, GERD, C, chronic constipation, or D, hemorrhoids? So GERD is reflux disease. That's when sometimes people have like the acid buildup. If they eat too fast, they lay down, they feel like their food coming back up. So that's why after you feed somebody, you don't lay them down immediately. They need to sit up for about 30, 45 minutes to allow their food time to digest, so they'll have less chances of acid reflux. All right, so the answer was A. So great job, great job. All right, so explanation. While the exact cause of Crohn's disease is unknown, a compromised immune system may cause the body to attack both the good and bad bacteria in the gastrointestinal system. This causes diarrhea and ulceration, as well as the inability to digest foods normally. You're right, Renee. GERD does have something to do with the gastrointestinal system. And so that's that acid reflux. 15, normal changes of aging in the integumentary system, include A, increased production of oil glands, B, increased blood flow under the skin, C, increased sensitivity to heat, or D, increased sensitivity to cold. What would be normal as you age? Yes, the answer is D, increased sensitivity to cold. And so oil production and blood flow slows down, resulting in drier skin and hair and increased risk of bruising. And elderly patients are typically more sensitive to cold. So temperature control of the environment and water for bathing, you must make sure the water is at a comfortable temperature for that patient. 16. This one's hard. This organ of the body utilizes 25% of the circulatory system, more than any other organ. So, which organ comprises of most of the circulatory system? Think neuro. Is it A, heart? Is it B, brain? Is it C, small intestine? Or is it D, liver? It's your brain, everybody. It is B, brain. At any given time, 1/4 of the body's blood supply is found in the brain. So, episodes of confusion can be experienced if the brain is not adequately perfused. For example, a stroke. Great job. 17. Your resident has had a stroke on the right side of his brain. Which of the following residual symptoms would not be expected? So, usually, you all, if a person has a stroke on one side of the brain, the opposite side of the body is impacted. So, if you have a right sided stroke, you'll have left sided weakness. So, this person had a stroke on the right side of the brain. Which of the following symptoms would not be expected? A is right hemiplegia. Hemi is half, plegia is weakness. So if they have a right sided stroke, do you expect the right side of their body to become weak or paralyzed? Do you expect them to have right eye visual disturbances? Or remember, I said if the stroke happens on one side, then more than likely the weakness is going to be on the opposite side. So, do you expect for them to have left leg weakness or left sided facial drooping? Which of these would not be expected? I'm torn between A and B. I don't know the answer. I know it's not C and D. I know. So, let's figure this out. All right, so right hemiplegia, so right sided weakness. And the explanation is all the other symptoms could be related to a right brain involvement as the right side of the brain controls the left side of the body, except for vision and eyes. See, I didn't know that. The right side of the brain controls the right eye vision. So we all just learned something. All right, 18. Alzheimer's disease is definitively diagnosed. A, using a blood test, B, upon death, C, with a physical exam, or D, with a mental exam. What are you confused about, Joy? When is Alzheimer's disease definitively diagnosed? We can suspect someone has Alzheimer's disease, but yes, and I don't want to pronounce your name. Is it Tawanichi? You're correct. It's diagnosed upon death. We don't know until we have an autopsy. We can say someone has symptoms, but we won't know until we actually look at their brain. And then based on what the doctors see on the actual brain itself, that's when they'll diagnose Alzheimer's. Renee, I don't understand. All right, and so there's the answer there. B, upon death, Alzheimer's disease is I cannot say that word, definitively diagnosed only with an autopsy after death. And that's what I just explained to you. Oh, 19, flatulence or overproduction of gas in the digestive tract may be a serious social and physical condition in the elderly. What are some of the causes of this condition? So, what causes an increase in gas? A, lactose intolerance, B, antibiotic usage, C, a bland diet, D, all of the above, or E, both A and B only. So when you're taking tests, if you see an option you've never seen before, that's probably the answer. So someone type E. Because E is the answer. All right, so it's going to be both A and B. And so we understand lactose intolerance. If someone is, if they're unable to digest lactose or dairy products, they're going to have an overproduction of gas. But whenever someone has been taking antibiotics for a while, it's going to kill the normal flora, the normal bacteria within the stomach, and it can allow some of the bad gut germs to form, and that can also cause gas also. So gas can be caused by both dairy products and also by antibiotic use. Thank you, Renee. 20, you're working a 3 to 11 p.m. shift. After dinner, your resident Mrs. Klein always goes to her room, gets ready for bed, and then sits in her chair and carries on a conversation with no one present. Miss Klein is talking to herself. What could this be a symptom of? A, sundowner's syndrome. B, visual or auditory hallucinations. Auditory means that she's hearing someone who's not there. C, a reaction to a meal content or dinner medication. Or, excuse me, D, all of the above. So your patient's sitting in the chair talking to herself. What could be the cause? Sundowners is like a term that we've made up. It's you're not going to really find that in the most of your medical books, but sundowners, that's whenever the sun goes down, your patients get confused. And so it just happens. We understand it happens, but the correct answer for this one is actually going to be D. All of these could cause this person to be talking to themselves over in the corner. So, all of the above, Miss Klein could be exhibiting this behavior from any of the listed reasons. It is your responsibility to report your observation to the nurse as soon as possible, so that we can actually investigate. Because maybe I'm giving this patient a medication at 7 p.m. and I don't know that this medication is having an untoward effect where she's starting to talk to herself and hallucinate. So your job as a CNA is, when you see something that's abnormal, go ahead and report it so I can go and assess the patient. So the answer was all of the above. So it's sundowners. It could be visual or auditory hallucinations, because we don't know if Mrs. Klein may have, a past history of psychosis. So she could actually have a diagnosis of mental illness, or she could have just been having a reaction to some nighttime medicine I've been giving her. So all of the above. Notify your nurse. Number 21, you all, your resident is on strict bed rest with her left leg elevated due to a blood clot. How should you help her to the toilet? This test is for just nationally to Wenatchee. It doesn't matter whether it's Prometric or Pearson View. Good evening, Marie. All right, so blood clot in the left leg. How do you help her to the toilet? A, bed rest does not mean she cannot go to the bathroom, so walk her to the bathroom. B, offer her a bedpan and turn her on her right side to place and remove it. C, offer her a bedpan and turn her to her left side to place and remove it. Or D, put a bedside commode next to the bed. All right, so you all, she's on bed rest because she has a blood clot in her leg. If we get her up and move her about, chances are that blood clot could travel and she can have a stroke, she can have a heart attack. So anything that mentions getting her out the bed is not an option. Now we need to figure out if we're putting her on the bedpan with her right side, turning her to her right, or turning her to her left. All right, and so Marie chose C, Belinda chose B, Renee chose B. The answer is B, everybody. Great job. Woohoo! Offer her a bedpan and turn her on her right side to place and remove it. Strict bed rest means she cannot get out of the bed for any reason. If her left leg is elevated, she should turn to the right. Okay. And then that way her left leg remains elevated whenever you place and remove the bedpan. Okay. 22, plantar flexion, foot drop, can be prevented with A, foot soaks, B, foot boards, C, toenail care, or D, proper shoes. When you have a patient who's in a bed for a long time, their feet start to go down as if they're pressing on the gas pedal. This is going to be problematic because when we put them in rehab, if we didn't do anything about that plantar flexion, when they learn how to walk again, their foot is going to be dragging on the floor. So, how do you, as a CNA, prevent plantar flexion? Yes, it is B, everybody, footboards. And if you don't have footboards, put a pillow at the base of the bed. Put a pillow so it can actually apply pressure against the person's foot until you can notify the nurse, who notifies the doctor, who notifies physical therapy, so we can get the proper equipment we need, maybe like a boot or something, to keep this person's foot in the proper position. So B is the correct answer. Remember, plantar flexion, we don't usually say that in the real world. The term you'll hear us say is foot drop. 23, your coworker is refusing to help with a resident's postmortem care. She says she's afraid of dead bodies. How should you handle this? A, find someone else to help or do it yourself and then report her actions afterwards. B, tell her that she is being silly and that she has to help. C, report her to the nurse and do not do the care until someone is there to help. D, tell her that you recognize her fear, but this is a part of her job and she needs to do it. She's afraid of dead bodies, but she's working in healthcare. All right, so we really don't get an out. I think the best response is either A or D. I'm going to go with D. Looks like Marie, Rose chose A, Joy chose A. Let's see. You all were right, and I am wrong. So find someone else to help or do it yourself and then report her actions afterwards. Explanation: if you are able and there is no one else free to help, do the care yourself. Report her actions after, as this is a part of her job and she needs counseling. The fear of dead bodies is not uncommon, and you cannot order someone to get over it, nor can you something postmortem care. And I do apologize, I can't read that on my screen. But yes, go ahead and notify your nurse. I know, Joy. I got it wrong. Don't laugh at me. 24, your resident is fairly young, but is in your facility because of mental deterioration. Which of the following may have caused this? So you have a fairly young person who's in your facility. They have mental deterioration. Is it alcohol encephalopathy? Is it B, Alzheimer's disease? Is it C, illegal drug use? Or is it D, all of the above? So when you think about some of these long-term care facilities, they have younger people there also. What would be a reason that a younger or a middle-aged person would be there with some type of mental disorder? Yes, everybody. D, all of the above. Your resident may be fairly young, but dementia, even early onset Alzheimer's, can be present in middle aged persons. And then, of course, from alcohol abuse, we could have the alcohol encephalopathy, and then illegal drug use would deprive the brain of oxygen. So that can also cause mental deterioration. We're on that last question. I'm going to miss you all. So, 25, Mr. Bond complains of pain and numbness in his heel. You notify the nurse. While waiting for the nurse to look at the area, you should A, elevate the foot on a pillow while the heel is hanging free. B, massage the heel to increase circulation. C, put on shoes and socks to protect the heel. D, perform range of motion exercises on his foot. All right, we have C, we have D. I'm not guessing because I'm gonna get it wrong. Let me see. Let me be fair. I'm gonna say A. Please don't let me be wrong. I'm right. Finally redeemed. All right. So A, elevate the foot on a pillow while the heel is hanging free. And so Mr. Bond's symptoms suggest a pressure ulcer is developing. Reducing or removing pressure is indicated. Never massage the site of a potential or existing pressure ulcer, and avoid enclosing or moving the site until the nurse has completed an assessment. So everybody, guess what? Great job. I appreciate you all. I have a long day tomorrow, but I will be posting some new videos on Saturday and Sunday. Renee, you know I appreciate you. I appreciate all of you all, and I wish you much luck and success. If you all have any, specific questions, or if you want to see a specific type of test, just please email me. I'm going to put the email address in the chat. It is admin@fltraining.com, or whenever I post the notification of our times for the videos on Saturday, it'll be on the YouTube community post, and you can just chime in under that about what type of video or what questions you have. All right, everybody, it's 8:45. Hey, Renee, you got 4 wrong. I think I got 3 wrong. So either way, we're still winners. Joy, I pray you pass your exam also. So you all, I'm so proud of you. You have a great evening, and I will see you guys and gals on Saturday. Bye, everybody. No, you didn't fail, Joy. What I say is you have an opportunity to remediate. So we're going to keep going through questions about 3 or 4 times per week. And then, just keep practicing. Usually if you don't answer something correctly, it's because you didn't understand the key word. And so that's why we have so many videos to assist you. So you didn't fail, just the opportunity to remediate. All right, everybody. Bye.